Hey, this is Christopher Fry, and this is my Indwelling Catheter Insertion video. Here's my ID. And you go ahead and scan the room. So first we're going to start off by identifying our patient. We have Jaguar J. Jones, medical record number 4176352, 4176352. We also see on the chart that there's an allergy to penicillin, and our patient is wearing an armband for an allergy to penicillin. We would also ask if there was any other known allergies, and we will also verify our hospital policy and our order. We do see a order for the indwelling catheter, and we'll also look for reasons to why we need the catheter. So we see it is required for immobilization for surgery, trauma, or other therapies. Strict urinary output monitoring as indicated by our care of plan, and to assist in healing of an open sacral or perineal wounds in incontinent patients. So next we would explain the procedure to our patient and make sure that we provide privacy. So now we would gather all of our equipment, which I have done over here, and we would don our goggles, place our trash can where I have already done so, and next we would perform hand hygiene. We would come to the patient's side and we would lower the side rails and raise the bed to a working height. We would also position our patient in a dorsal recumbent position, and we would have our knees slightly bent on our legs to make sure that they were out of the way of our sterile field. So next we would perform hand hygiene, and we would don our clean gloves, and we would provide perineal care. So we would clean with a washcloth with soap and water the inner portion of each thigh, and each time that we move to a different area or to a different swipe, we would use a different portion of the washcloth or just use a whole new washcloth in general. So next we will move to the outer portions of the labias, and we would clean from front to back of the one farthest away from us. Then with a different part of the washcloth, clean the portion closest to us. Next we would spread the labia majoris, and we would clean from front to back, farthest away from us, closest to us, and down the middle, ensuring that we clean all areas from the pubis to the rectum. And if we were doing this on a male, we would start at the glans penis and we would work down the urethra meatus in a circular motion. Each time after we do a circular motion, we would use a different portion of our washcloth or a brand new washcloth. We would also clean the scrotum and ensure that the whole area has been cleaned. This washing the perineal area lowers the risk of contamination during the procedure. So next we are going to open our catheter kit, and we are going to place our bag as our garbage bag on the opposite side of where we are on the patient's hip. And we are going to open our sterile kit. And next we would take our clean gloves off, perform hand hygiene, and we are going to don our sterile gloves. Normally we would be above our hips, but for the purpose of this video, we will not be. Now that we have our sterile gloves on, we are going to remove our sterile drape, and we will place the shiny side down, and we will be careful not to contaminate. Ensuring that there's overlap between our drapes and our patient. So next, we are going to remove the tray and place it closer to our patient. We are going to put the lubricant into our tray, and we are going to open our benzidine swabs, which I've already done, and place them in here. And we are going to go ahead and connect our water fill syringe to our balloon portal. Once we do that, we are going to lubricate our catheter, and you will lubricate 1 to 2 inches for a female and 5 to 7 inches of the catheter for the male. Once we do that, and I just broke sterility by touching my patient's leg, so we normally start over the procedure, but we are going to move on. We would take our non-dominant hand and spread the labias, and we are going to cleanse the area, starting farthest away from us, going from front to back, then closest to us, and then down the middle. For a male, we would normally start at the glans penis, and in a circular motion with each one of the swabs, we would rotate down the urethra meatus, and we would do that 3 separate times. So now we are going to explain to our patient that the procedure is about to begin, and that we would have them bear down as if they were voiding, or take a deep breath upon insertion. So in a male patient, you would have the penis perpendicular to the body, and you would have slight traction during insertion. So we are going to move this box closer to our patient, and we are going to insert our catheter, and we insert until we receive urine output. Once we receive urine output, we would insert 1 to 2 more inches for a female, and we would insert all the way to the bifurcation for a male. So now we are going to hold this into place, and we are going to inflate our balloon. Once the balloon is inflated, we can let go of our catheter. We will remove our water fill syringe, and we would gently tug on the catheter and then slightly advance it forward. Once we slightly advance it forward, we will now demonstrate how we would make sure that the catheter was secured. And so what we are going to do is we are going to use our stat lock. And this stat lock here, you will remove the sticky and place this on the inner portion of the thigh. And once you do that, you want to make sure that there is slack in your catheter line. And you are going to put at the bifurcation, there's a little slit, and you will close and lock this into place as so. And if you need to remove it, you'll simply press this button in and open it, and it opens just like that. And you would make sure that there was slack in your line in order to make sure that there was no trauma. And to remove this from your patient's leg, you would remove with alcohol. So now we're going to show you how to obtain a specimen. And so I have my bed frame over here. You would not connect your bag to the bed rail. And once you connect it to your bed rail, you would only obtain a urine specimen from this port right here, right after insertion. So you're going to take your specimen container and you are going to open and you're going to hold it cap up and you are going to come down here, remove this port, and you are going to be careful and you are going to open this port over your specimen container, being careful not to touch the container itself. Once it is to where you need it, you will close and you will insert back into the tube like so, and you will cap your specimen container and send it off to the lab, and you would also label it. Other ways to get a specimen is a port right here. And so what you would do is you would open your specimen container, being careful not to contaminate. And you would take a syringe with a needle and you would clamp your tube right here and you would stick the needle into this port right here and you would slowly pull back to obtain your urine sample. Once you had the amount that you need, you would come and you would slowly plunge the urine into your specimen container, being careful not to splatter. And you would label it as well as cap it, and you would send it off to the lab. So now we will clean up our area. Throw this in the garbage. My bag fell off. And next we would remove our sterile gloves, being careful to go glove to glove and skin to skin. And we would perform hand hygiene. After we perform hand hygiene, we would lower the bed to the lowest position, raise the side rails, and we would place the call light as to where the patient could reach it, and we'd ensure that they were comfortable. We would next document the procedure. We would document that how the procedure went, as the patient tolerated it, the type of catheter, the amount, the color of the urine, and the consistency of it. And we would also describe how we would do daily care of the catheter. And basically, we would be doing perineal care. We would be using soap and water around the catheter, being sure not to cause any trauma to the catheter area. And so next, we will move on to removing our catheter. And you want to remove your catheter as soon as medically indicated. So what we will first do is we will perform hand hygiene and we will put on our clean gloves. And so next, after that, what you are going to do is you are going to take a graduated cylinder like so, and you are going to do the same process as you would for a sterile specimen, and you are going to drain your bag of all of the urine that is in it. And you will then, you will measure how much urine that you had collected, and that would be part of your documentation. So next, what we're going to do is you are going to take your 10 milliliter syringe, and first you are going to loosen it, and then you are going to pull back 1/2 milliliter. Now we are going to connect to our port and allow gravity to deflate the balloon. Once it is completely deflated, we are going to remove our cap, and we are going to remove our catheter, and we are going to discard of our catheter. After we discard of our catheter, we are going to remove our gloves and perform hand hygiene, and we are going to document how the patient handled the procedure. We are going to document how the catheter tip looked, the intactness of it, the color, the amount of urine that we collected, and the odor. And we would also show that we taught our patient signs of the UTI, and signs of the UTI would be such as urgency and frequency to void, back pain, flank pain, fever, or chills. We would then leave the room, and we would come back after 4 to 6 hours to check and see if our patient had voided. If they had not, we would then palpate the bladder, and we would or we would have a bladder scan. And after we removed our catheter, we would also make sure that we provided perinatal care. And with that, that concludes my catheter video.